Good evening, everyone. I am Lisa Morgan, a kindergarten teacher and GAE president.
I'm Sharon Doe. I'm the GAE Vice President, and I'm a physics teacher in Richmond County, Augusta, Georgia.
And I'm Carly Shaw. I'm the GAE Secretary Treasurer, and I teach physical science in Fulton County, Georgia.
And I'm Joe Fleming, lobbyist for GAE.
So we have a lot of things that have happened since we talked with you all last week. The legislature has started, and the bills are beginning to drop for the legislature. So, Joe, why don't you tell us about what we've seen so far in the first 3 days of the 2021 legislative session?
Yeah, not much. They convened Monday. I don't think there's been a session of either the Senate or the House that's lasted longer than 30 minutes. Certainly, if you take out the chaplain of the day, there really has been no business conducted this week. In fact, the House of Representatives has not even named their committee chairman or the composition of those committees yet, as of at least the start of this Zoom call. Hopefully tomorrow we'll get an idea on whether Jaspers will be back as House Education Committee. There are rumors that he might be a candidate for the Ways and Means Committee. And we expect a new House Retirement Committee chairman and new members to both of those committees. Even the Appropriations Committee, which will be meeting all next week on the state budget, the names of the members of that committee have not been released as of yet. Tomorrow, Thursday, will be the governor's State of the State address before the General Assembly. Usually he outlines some of his budget proposals, if not all of them, or we may even see a full budget tomorrow, but certainly some of the highlights of what he anticipates for this legislative session. And that will be an important event for the General Assembly. We'll have a much clearer idea on what the governor's budget looks like and any other proposals he has, especially those affecting education and teachers. There are a few bills out there already. They've been slow to drop. We've got a voucher bill in the House. That's House Bill 60. This is basically a COVID voucher bill, meaning that students would be eligible for the existing special needs scholarship. That is a taxpayer-funded subsidy for private school tuition. If a student is in a public school where they've not had 100% in-person learning as an option, they would now become eligible for this private school scholarship that's paid for by the state of Georgia and taxpayers like you and me. The bill also has some transparency aspects to it. It takes away even more transparency from the program by eliminating the names of the schools that participate in this program. And certainly the expenditure of government funds ought to have complete transparency. And we'd like to see more transparency in the existing program along the lines of income, how much the families of students that are utilizing this make. I think the information we do have suggests that is wealthier families sending their kids to private school or helping to lower the bill for that. Voucher proponents always touted as a hope for those who don't have the means for private school as an opportunity to get their children into private school. The average taxpayer paid tuition scholarship for private school in Georgia is about $3,600. To go to Westminster or Pace, you need to pay $40,000. So it's false hope to suggest that poor families are going to be able to get their kids into their favorite schools, favorite private schools with this scholarship. Not to mention the schools don't have to accept them. They don't have to have any special programs to accommodate some of their needs. It really is false hope in so many ways. We expect another voucher bill to be introduced possibly in the Senate, which mirrors last year, which would introduce at least 300 or 400 additional medical ailments or conditions that would qualify a student for a private school scholarship. So we'll be looking in the Senate for that. And I expect this to be a major fight. The proponents believe that COVID has to selling their voucher program during COVID is a smart move because they can claim that it gives parents more choice at a time when some public schools are closed, but many private schools have shut down because of COVID as well. St. Pius did, for example, for a number of days. So this will be interesting to watch. The House Bill 60 has been assigned to the Education Committee chair, Art Committee. We don't again know who the chairman of that is or the members of that committee, hopefully soon. We also have House Bill 32, which we were discussing amongst ourselves before this call began. This is from Dave Belton out in Buckhead, Georgia, the incorporated Buckhead, Georgia, which is in Morgan County. Dave's heart is in the right place. He's trying to address a teacher shortage needs in rural districts and low performing school districts by offering a $3,000 refundable tax credit for teachers who would agree to teach in those districts. There's a problem with the bill is that it does not benefit those teachers who've been laboring in difficult schools over the years. It's only for teachers who are new to that district, who sign a new contract in that district. But we'll be working with Representative Belton to see if we can make changes in that that would really help rural and underperforming schools and provide some reward for those teachers who have been working in those kind of districts. The other bill that is also been filed and is going to the Senate Education Committee is SB 3. This is a perennial bill, but it's one that we've supported in the past and that has shown some bipartisan support in the Senate last year, and that is to raise the mandatory age of education from 16 to 17 years of age. In the past, it's been introduced and largely knocked down by Republicans. I presume on cost, they might argue, but I can't imagine the cost being that terrific for adding students 16 to 17, most of who are still in school, but some who do drop out. So we'll be watching that bill and seeing how that progresses. In the Senate, we do have a new education chairman. That's Chuck Payne. We'll be working with him. I'm going to try to get Chairman Payne on a Zoom call with us at some point to talk about education issues. I don't know that he's an expert on those issues, so we have an opportunity to share with him our concerns this year and going forward. We do have a new chairman of retirement committee in the Senate. That's Randy Robertson. I think he's a guy we can work with. We'll also be setting up a call with him for GAE retired and for GAE members to introduce him to our issues, explain our issues to him, and hear what his priorities are for the retirement committee this year. Obviously, protecting TRS and the defined benefit plan that it offers is one of our #1 priorities. And again, I mentioned earlier, we should have a new retirement chairman in the House and possibly a new chairman of education in the House announced sometime soon. So with the governor's State of the State address tomorrow, Thursday, again, I mentioned that we'll have a more clear picture of what the governor's budget priorities, not only for mid-year adjustments to the current budget. Revenues are up. They're up 7% in December over December of 2019. So I'm curious to see if the governor is going to propose in the mid-year adjustment to this fiscal year budget any additional money for public education and QBE. Obviously, I think everyone knows public education and QBE were cut by $1 billion in this current year budget. And we're not going to stand put and wait around while austerity cuts build for several years. We've got to begin to recruit that money right away. Next week, the General Assembly will not be in session. They're taking Martin Luther King Day off, and then the Budget Committee will meet for the rest of the week to discuss the proposed budget of the governor. I think Superintendent Richard Woods is going to speak on behalf of the Department of Education on Tuesday at 1 o'clock. That will be streamed live from the Georgia General Assembly website. But next week, we'll be talking a lot about numbers, revenue, and budget, and see what comes from that. There's been some talk that the governor may come with some pay raise for teachers this year, depending on the revenue forecast. I don't want to get anyone's hopes up. He has promised 5,000 before his first term is up. So if he doesn't make it, and he's done 3,000 so far, so we may see part of that this year, maybe not. But I do expect him to honor that promise by the time 2022 comes around and complete that $5,000 pay raise that he offered. That's kind of an overview of what's going on right now, Lisa. I'm happy to take any questions, or if you guys have anything you want to bring up, feel free to do so.
I want to talk about something I saw first thing this morning, and people that have been watching us throughout this will remember Dr. Stephen Owens from the Georgia Budget and Policy Institute has been here with us. And I saw this morning, they released a report that Georgia, we are the 6th largest public school system in the country based on our number of students. And I'm going to make sure I'm saying this correctly. The 6th largest public school system, but we are 35th in per student funding. And when you sit and think about, I mean, we're not the 6th largest state in terms of population, but we're the 6th largest public school system. So we have more students than states that are larger than us, but we're 35th in per student funding. And we know $950 million because was cut from public education this year. Mm-hmm. But that's a huge, number one, to get that back, but that we're 35th. That kind of blew me away when I saw it this morning, to show how underfunded our schools really are.
And just think, with that bill about the vouchers being presented, that will take even more tax money away from our schools.
Yep.
Most schools are already struggling with those budget cuts from last year because of the COVID. And then just to think the vouchers could come in and take even more money away, that would be a serious, serious problem.
Yeah, you're right. You're right, Sharon. That's exactly what I thought about. And I guess thinking about that voucher bill, we've been talking all year, it seems like forever, about the health and safety of our students and our colleagues and our families. And I'll just say this. If you're saying now that you are going to punish the school systems who did the right thing and are trying to, through offering choice, through having a hybrid schedule so there are fewer students in the classroom so we can socially distance, who are doing the right thing to protect students and parents. And now you're saying because you did the right thing for the health and safety of your students and employees, we are going to allow the children to leave. Oh.
So I want to put this up real quick, Lisa. Can you see the cumulative budget cuts? This is from the Georgia Budget and Policy Institute. As you can see, it's a little small. Essentially, we've taken 10 billion. Does it say 10 billion? There's been a cumulative of $10 billion. I can't read that. Yes, $10 billion since 2003 cut from public education. So the trend is that we're cutting more and more and more from public education. Vouchers are going to cut more and more out of public education. And we've got to stop this trend. And you can see why we're 34th in the nation by how much has been cut over the years.
Yeah. Yeah. And I just, I know you all can't see the comments, but I just put in the comments for the people that are watching, a link to, the report that Dr. Owens released through the Georgia Budget and Policy Institute this morning about, and it's all about state education funding in Georgia. And so, it talks about, yeah, that graph is on there. I can see it on this one. $10.184 billion. And that's billion with a B that has been cut from our public schools. And let's think, when we say that, $10 billion that has been cut from our public schools. We have 1.7 million students. So if my math is right, that's about $1,000 per student. Very rough math, because we're 1.8 million students. So 10 billion, we round up to 2 million, that would be $500 per student. Think about what we could do if we had that added back.
Well, that's why teachers are being asked to do more with way less. And with budget cuts from the state, districts are asked, to do more with less.
Yeah, definitely. And I know
less funding, less pay, it's just less and less and less.
And all of that does end up affecting student achievement.
Mm-hmm.
yes, it does. And I know you all teach science.
We do shoestring budget labs.
Yeah, that's what I was thinking about with you guys teaching science. Science labs and the materials, that costs money. I know teaching kindergarten, all those fun projects that, we like to do, that costs money.
Under QB also, but transportation funding for local districts has basically been eliminated. So that local districts have to pay for maintenance, gas, new buses, because the legislature is not funding that anymore, means there have to be cuts in other areas by the district themselves. So, which is not going to, classroom education.
Yeah. Our ESPs will say we need to talk about that. I know I've talked to bus drivers, and the bus they're driving is 15, 20 years old.
Yeah.
And I would think if we talk to some of our school nutrition workers, their equipment's probably the same age as well. That we're literally all in this together, and what they need to do their job and provide for our students is suffering the same impacts,
When
And they've really had to step up during this COVID. They've really had to step up. And delivering food, cooking, even with the students not on campus, they're still having lunches go out. They're still delivering food. The bus drivers are. We have so many people, like you said, we're all in this together, and the appreciation is not there. We used to be great, and now the appreciation has gone way down.
Mm-hmm.
The pay is not there. They don't even have a living wage. And I don't see anything about that being talked about in the budget coming up. It's disappointing. It's
Yep.
the things we ask them for, and I feel like it's fallen on deaf ears. So it's very disappointing.
Well, Dr. Owens also pointed out on our Lobby and Learn that raising the cigarette tax to the national average in Georgia would raise, I think he said, correct me if I'm wrong, Lisa, $600 million, which would restore a big chunk of the money we lost this year. And that's just to bring the cigarette tax to the average in the nation. Currently, I think we have next to the lowest or in the bottom 1, 2, 3 in lowest cigarette taxes in the nation. And, just raising the cigarette tax alone, not to mention any other revenue increases or elimination of tax breaks would make us whole this year if the General Assembly has the will to do that. I don't expect to see that in the governor's budget. And I think tax increases probably have a little bit of a long shot in the legislature, but we're in a very difficult time. Revenue is essential, and I think we should be advocating for those kind of revenue enhancers, especially directing them to education as much as possible. Lisa, I want to mention one other thing. I should have started my part with that, and that is, what is life at the Capitol like right now? And for those of you that like coming down there or want to come down there, it's a very difficult place to operate right now. With the break into the U.S. Capitol occurring, that has created a real security presence at the Georgia Capitol. SWAT teams, National Guard members, whatnot, which makes access and movement a little more cumbersome, but for the right reasons, at the Capitol. And it's tighter now on COVID restrictions than it was in June, after the legislature recessed for COVID and then came back in. So you're not really able to get a seat in the Capitol. They've got curtains essentially roping off access to where we would normally say working the ropes or seeing legislators. It's much more difficult to locate legislators and find them. And my recommendation would be to stay away for now, and certainly until at least after the budget hearings are concluded and we can look at how things look like the week after next. But it's a difficult place to operate, and there is a lot of social distancing going down on there. I've talked to lobbyists who said they're not planning to be down there physically at any point in this session. I'm not ready to go that far yet, because I think there are members we still need to meet and talk to, and so we'll see how that goes. But as a visitor, I would probably stay away from it for now.
So I would say, let me roll that in my teacher processing. So what I'm hearing you say is that for our members that want to lobby and want to contact their legislators, the best thing we can do right now is send them an email,
Right.
call their office, and if we are coming, we need to make an appointment to meet with them in their office and not expect that we can, as we've always done before, come down and they're going to come out and talk to us during the session.
Yeah, scheduling an appointment is probably one of the key things that you said. It's more difficult just to, an impromptu visit kind of situation. Different members are comfortable with different things, but a lot of them are going to insist that you make an appointment.
Okay. All right. And so that's one thing we are asking our members. We will be sending you member alerts and asking you to contact your legislators. And so that's one of the things we're really doing. I'm going to go back. Let's step back a minute, Joe. You mentioned about the tobacco tax.
Yes.
And I actually found something when I was looking for that link about Dr. Owens' message about school funding. There is an image there of from the Department of Audits and Accounts to Minority Leader Beverly
Mhm.
in the House that says House Bill, it's a House bill, and they have done the fiscal impact, and the impact in fiscal year 2022, which would be the coming year, if this, it would increase tax on tobacco and vapor products effective July 1st, 2021. And the increase in revenue would be between 691 and $702 million the first year.
Wow.
Yeah.
Yeah. So,
Not to mention it would have an impact on the number of smokers in the state, which is probably a public policy good.
yeah, and might save us some in healthcare.
Yep.
That sounds
Potentially.
like a win-win.
Yeah,
Mhm.
it does. Yeah, it does.
Win-win.
It does. Okay. So I'm also going to put in the, as Joe was talking about, the fact that we're really not able to go to the Capitol right now, et cetera. We are planning for GAE Day at the Capitol, and I just put the registration link in the comments. GAE Day at the Capitol this year will be February 25th, and it will be, because of COVID, virtual. So we're still trying to be creative in how we're going to do that so that our members can see from and speak to legislators. But it will be virtual, and the link is there. You can go ahead and register now. So we will be trying to get, last year we had lots of speakers that came and spoke to us at Day at the Capitol, and we will be trying to get them, and we'll work it out some way where we can maybe have a side room and they can come in and log on with us and speak and then be finished. But we do want you to be involved with this legislative session because, as we know, funding is going to be a really key issue for all of us. And not just salary, but for our students and for the things they need. One of the things that has been talked about is the new COVID relief bill from the federal government. The school board's meeting in the morning, the state school board, and the money Georgia's getting from there, they are going to allocate to the schools. And that allocation is being done based on the Title I formula. So if your school gets a lot of Title I money, you're going to get, or if your district gets a lot of Title I money, you're going to get more of the money from the COVID relief, which hopefully will help with those things that we need. PPE, cleaning supplies. Yes, Sharon?
I wanted to know specifically about the sick leave or sick days. If someone should become ill with COVID, do educators have to use their own sick days or sick hours that they've earned?
The 80 hours of sick leave that were in the previous FFCRA or FFRCA, I can never remember which goes first, the C or the R. I think it's the C. Those provisions did expire December 31st. So if your local district is willing to extend that leave to you without you using your own sick leave, then that's a district by district decision that they have to make.
Oh, it's district by district.
It's district by district now because that federal provision did expire. I know our local president in Catoosa County has worked with the superintendent there, and they are extending it. So that, and I just know that one because, you know, she's talked about it. But that is something that, yes, it is important that everybody knows that is not there. We have a question that says, what about the generic ADA forms that doctors refuse to fill out because they're not COVID specific? That's, I know we have a lot of our members who are completing ADA and FMLA and all, every alphabet soup we can think of paperwork. If you're having a concern with that, contact your UniServe director, because they're probably going to have to help you with that on a case-by-case basis. And then if it's not just you, that also helps us at GAE know if the UniServe director gets one call about something, it's a concern and they're helping one member. But if they get the call from 15 members, then they know it's something we really need to look at. And if they get 50 calls, then they know it's something that really is a specific issue that needs to be dealt, not just at the individual level, but it's something that probably needs to be with the school board and the superintendent, etc. So, and we have one of our members that said we would have to make sure they did not cut other funds that support education if a new revenue stream is established. And yes, that is exactly right. If we are going to have additional funds that are earmarked for education, it needs to be additional added to, not additional, and then we'll take some more away and use it somewhere else. And yes, that is exactly right.
Why are they changing? I'm just wondering, Joe, if you know, I noticed you said they were thinking of raising the mandatory school age to 17. Do you know? I was just curious because I don't see why they haven't done that already. I don't see it being a big cost implication. And I think it would encourage more students not to drop out because they only have 1 year left, you know, maybe until they turn 18. I just didn't know if you knew anything about that, or I just was curious. I'd never heard that before.
Yeah, I think 16 is a holdover from more agrarian days, when kids may be working on the farm, things of that nature is probably how it started. And I think over the years, there's been some reluctancy from some Republicans and rural legislators to change it. I don't believe there's an argument to be made that it would be a substantial cost to education funding and DOE. I think it makes common sense. But for some reason, yeah, for some reason over the years, it's just not found traction. Last year, when a committee hearing was held on it, it enjoyed the support of, for example, Senator Lindsey Tippins, Republican from Cobb County, Matt Brass from around Carrollton, another Republican supported it, but it did not get out of committee. Maybe it's a matter of time, but I'm in agreement with you. I think there's no good reason not to make it 17.
Yeah.
I mean, certainly would keep some kids off the street, maybe.
Yes.
I think there are a lot of good reasons why it should be done. If it comes up, we'll testify on it, but it's been some roadblocks in the past.
And I want to add one thing here that I know we've asked in the past and they have done in the past. If we're going to change the compulsory attendance age and increase it from 16 to 17, we need to do the opposite end as well. And I know I'm going to shock many of you when I say kindergarten is not mandatory in the state of Georgia. They get 50 calls, then they know. And so the and I know we found this year with COVID, and lots of parents who have redshirted their kindergartners and have not sent them to kindergarten because they're 5 and they are not subject to compulsory attendance. Compulsory attendance is 6. So they can, and if you've had a kindergartner in the past 20 years, do you really think they can walk in and at 6 and start in 1st grade without going to kindergarten?
Absolutely not.
No.
I mean, they have pre-K now, and
Yeah.
you want to keep a child out for kindergarten and then walk it? Oh, no.
Yeah. And that has been when they've looked at the data for the decrease in the number of students we have this year, and they believe it is due to COVID, the biggest decrease was in kindergarten, where parents kept their kids home. So, well, they're keeping their kids home. We went virtual all the time, but they weren't enrolling them for public school. So I don't know if they'll be willing to do both ends, but it is something that has come up before. And I know a couple of times they've added the 5-year-olds to that as well.
Hmm.
Yeah.
Okay.
So anything else, Joe, we need to know about what's happening at the Capitol?
Yeah, a couple, or just a few things. I forgot to mention that the governor's state of the state is at 11 a.m. tomorrow.
Okay.
It's broadcast on GPB, Georgia Public Broadcasting. And if you want to watch it live stream, you can do that there. And I just want to mention that I'm excited. We're doing something new this year, and that is we're doing a kind of a webinar for legislators this year on some of the issues of importance to GAE and education issues that will be before the General Assembly this year. We've sent out an invitation to every legislator and hope to have good attendance. You know, we count on our legislators to be experts on education, road building, agriculture, workers' compensation, which is unreasonable. And so we want to be a resource to them on education issues they'll be faced with, talk to them about our position on those issues, answer any questions they have. So I'm excited about that kind of what I call Education 101 or webinar for new and long-term serving legislators.
Good. So tomorrow in the State of the State, you said earlier, the governor usually gives some of his budget.
Yeah, he'll highlight, some budget items. Whether the actual full budget will be available, stack of that is the budget, remains to be seen. And there are always all sorts of details in there that are important to sort through. But I think, if he had something to say about teacher pay raises, I would expect to hear that tomorrow. If he's silent on that, that might indicate where he is for this year. I know he's already talked about additional money for freight transportation in Georgia. There's a draft of a bill floating around of a bill he calls the, gosh, I've forgotten already, Teachers First Act, which we're taking a look at and analyzing now. I don't know if it changes a lot of things, but I think it's something he might promote tomorrow as well. So yeah, I don't know if we'll have the full puzzle completed tomorrow as far as the budget goes, but we should have some key indicators.
Okay. All right. Okay, y'all, it's that time. So I'll go ahead and depress us all. As we've been talking about the legislature and the COVID restrictions there, I don't think the COVID restrictions there are surprising to any of us because we have all seen the numbers, we've seen the news. And when we see these numbers, I think we're becoming numb to what they mean, but we really need to sit down and think about that when we see the number of cases in the state of Georgia, and it's this horrifically high number, and we don't have a frame of reference for it. I saw somebody say that we are now having more deaths every day in our country than we did on 9/11. And we were all shocked on 9/11. We were just shocked. So it's, you know, but here it is. Here's the number. There are now 67,955 confirmed cases, ages birth to 17 in Georgia. Last week at this time, there was 61,983. That's an increase of 5,962 cases in 1 week. November 30th is kind of like the date I've been using because, when it started going up so much in December, we were like, oh my goodness. November 30th, since then, we have had 27,594 cases. That 27,594 kids are sick. And they didn't have to be. And we don't know if there's going to be a big impact going forward. We just don't know. So that's going to bring me to the next update I wanted to give everybody and make sure we got this in tonight. And we've talked about this several times. In fact, one of our Facebook Lives, we streamed for you our Rights at Night with our NEA General Counsel, Alice O'Brien. So on December 28th, a motion for a preliminary injunction was filed in that case. So it's still going forward. The motion for preliminary injunction was filed, and it asks for 3 things. Number one, and it's Paulding County, but remember, Alice told us we're doing it in one county because if we went in one county, then it's gonna, everybody, all the other districts are gonna be like, okay, we better follow or they're gonna sue us too.
Ripple effect.
Ripple effect. Number one, masks required for everyone in the building, on the bus, from the time they step out of their parents' car or step on the bus in the school, masks required. And we know in some of our systems, masks are still, quote, strongly suggested. No, mask required. Number two, social distancing and following the CDC guidelines for allowing social distancing be required. And number three, which I think we'll all agree, that administrators are required to enforce the mask mandate and the social distancing. So those are the 3 things that are being asked for in this latest part of the lawsuit. And I know people have said, well, lawsuits take time. Yes, unfortunately they do. But we're in Georgia. We don't have collective bargaining. And, this is the way we have to do it. The other thing we have that you can do, however, is email the school board members if you have school board members who are saying masks aren't important, keep sending them that information, keep emailing them, keep the pressure on there, because that's who can fix it before then. So I just wanted to let everybody know the update where we are in that lawsuit, that we are still working. And we are still asking, if you look at the map, it's all about health and safety of our students, our colleagues. We are losing our colleagues.
Yeah.
We know there have been educators who have passed away. And it didn't have to be that way. And if we do the right thing, we can prevent it for somebody else. So there's my depressing thing for the week.
Well, it's infuriating.
Yeah,
It's just infuriating. It's like, why are the powers that be not looking at these numbers and making some different decisions?
mhm. Yeah.
It's mind-boggling.
And if we look at that map on the Department of Public Health website that, you know, shows the cases per 100,000, y'all remember way back in June, they were saying if there was more than 100 cases per 100,000 population over the 2 weeks, that
That just went out the window.
yeah, it went out the window. And I think one reason it went out the window is because they realized if we were following that, no public school in the state of Georgia would be open right now, because the cases are,
Too
you know,
many.
They're spiking.
it's beyond what's a word for spike, that it's, you know, when I think of a spike, it's going up, but it's going to come back down. This
Right.
just seems like a never, it's going up and up and up and up and up and up.
There's no end in sight.
That's what it feels like. That's what it feels like. And that's the other thing we needed to talk about, I think. The vaccine.
Yes.
Dr. Ah will be here with us next week. We've been trying to work it out so she could be here to talk with that. But I know some of us were hopeful because educators in Georgia are in Group 1B, which would be the next group to get the vaccine. But in the press conference yesterday, Governor Kemp said the goal right now is that all of the long-term care facility patients in the state and all of the healthcare workers in the state are vaccinated by the end of January. So that puts anybody in Group 1B at least February before the vaccine will be available for us. And it sounded like when he said the goal is the end of January, it kind of sounded like it may be longer than that. And that's just getting the vaccine here and getting people vaccinated. So have you heard anything different about that, Joe?
No, I watched the governor's press conference like you. It sounds like they're having some difficulties in getting enough of the vaccine and getting it distributed.
Yeah.
So I think the timeline that you just outlined is probably about right. I saw one of the questions on Facebook was how will they get that? And I guess the state is directing some of that, but local areas may be directing the inventory that they have as well. So stay tuned.
I think he said that CVS and Walgreens have been contracted for the long-term care facilities. And I don't know, it seemed to me like Governor Kemp was frustrated with it yesterday.
Yeah. if I have to get my pickup truck and.
Yeah, yeah, yeah. I did kind of laugh when he said if he could go out and get in his pickup truck and take care of it, he would. Um, so,
Yeah, I think there's a lot of frustration in maybe not having enough vaccines and not getting what they have out as quickly as they'd like.
and I think some of that, I'm going to be blunt here, a lot like I'm not usually blunt. Um, you know, when they first announced the vaccines, leadership at the federal level was saying 100 million people would have the vaccine administered by the end of December, and we're nowhere close to that. And I think we all got excited. The vaccine's here. We're going to get it. Things are going to get better. And now it's going much slower than we had anticipated.
Well, that was one of the points that Dr. Gale and Dr. Marks brought out last night in the NEA town hall about COVID. And some of the places like the CVS, those places can administer it, but the vaccine is so delicate and the temperature that's required for it to stay viable, that temperature is so low, and CVS doesn't have the capability to keep it at that lower temperature. So once you take them out, you have to go ahead and administer them in a certain amount of time, or you'll lose the vaccine. It won't be viable anymore.
That was something that another member said, and we'll ask this question next week when Dr. Oz here with us, that she's concerned because the health department in her county has said they don't have the facility to keep the vaccine that has to be, I think it's the Pfizer that has to be kept so cold. So that is a concern. And I would think that we probably have quite a few rural areas in the state that we may not have that capability. So it is concerning. Yes, it is.
What I just thought about, what just popped into my head when you said we have quite a few rural areas. I was thinking something like a bookmobile, like a medical mobile, maybe could go to those rural areas.
Yeah.
Something similar to how the bookmobile would go to areas that were far away from the cities and from libraries.
And I think that'll depend, can they keep it cold enough there?
Yeah.
So
I know they're using the Georgia, what is it called now? The Mercedes-Benz Stadium. I know they were using that to have people come to, because they gave out the number for you to call if you were 65 or older. I know they're going ahead and doing those people now, and you could call and make an appointment. It's by appointment only. And earlier today on Facebook, they said all the appointments were gone. They're into next week on their appointments now.
Yeah.
So they're being used and used quickly. So.
And I'm sure that's going to happen, that they continue to be used and used quickly. I don't think I shared with you all my experience getting tested, did I?
No, you haven't.
Oh, okay. So yeah, so I needed a COVID test, had a family member that I was exposed to. So I went on the website for the health department. I live in Gwinnett, and searched for appointments through the health department within 20 miles of my home. There was no test for 2 weeks, no appointments. So then I went urgent care with Eastside Hospital, had drive-in testing. So I went to the drive-in testing. I get in line. I sat in line in my car for about 30, 45 minutes. And then I see two cars in front of me. They walked out and taped a sign on the back of their window. This is the last car we will see today. Okay. So the urgent care you could schedule an appointment and go inside for testing. It was the rapid testing if you did it that way. So get my phone, get online, start searching for an appointment for rapid testing. Now, this was on Monday. The first appointment they had at the urgent care for testing was on Thursday at 3:30. Yeah. So even testing, it's still a backlog. I did get my test. Um, I got my test that day, but that's because I went ahead and drove to Tennessee and pulled up to the urgent care there at 6 p.m. There were two people in line in front of me, and we were actually standing in line outside, socially distanced. Had my test back negative at 7.
Wow.
But yeah, so getting a test is difficult. Getting a vaccine is going to be difficult. So we are all going to have to exercise our patience as we go through the rest of this.
And kindness.
Yes.
Kind to those people that are doing the test, and because they're just doing their job the best they can. I can't imagine being a healthcare worker right now.
Yes. 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 I agree. You are right. And one more thing that I had a commercial. We talked about the legislature being in session and all these laws. But one thing that we didn't talk about is the fact that if you are in a school system that is a strategic waiver school system, they can waive all these great things anyway. So I put the link in the comments for the next Rights at Night, which is January, make sure 26th at 6:30. And Joe and I will be repeating our presentation about strategic waiver school systems. So if you don't know what that means and how that impacts you in your classroom and your class size and your duty-free lunch and your planning period and how it impacts your students with the number of ESOL teachers and the number of gifted teachers and the amount of health and physical education they have, join us January 26th. And we'll be talking all about strategic waiver school systems and what that means and how that impacts you. And that link is in the comments. So that's my last commercial for tonight. And y'all, we have been talking for almost an hour. So let's have a good thought to send us into the rest of this week. So it is Red for Ed Wednesday. We got our red on. Yeah, you've got your red. So Carly, tell us something good we're gonna think for the rest of this week.
Oh wow, me first. Okay. I don't know. Well, I'm glad that we are gonna still have our day at the Capitol. The GAE is still committed to our day at the Capitol, even though it's going to have to be virtual. I'm glad that we are being responsible with that day and that we are still going to have a way for our members to be able to talk to their legislators. So I'm happy about that.
Yep. Okay. Joe, what's your good news?
My good news, I'm entering 2021 with a positive, optimistic attitude that things are going to get better on a lot of fronts.
Sharon?
Well, my good news is the students who return tomorrow, they would be face-to-face students under normal circumstances. Well, I use the term normal
What is that?
loosely, very loosely. But our face-to-face students will be returning online. They'll be returning online tomorrow. So I'm interested to know how that is going to turn out with these students because they haven't been online before.
A new thing. Okay. And I am, like Joe, I am optimistic. I am hopeful that 2021 is going to be much better for all of us. I think 2020, we were all happy to see it go. Yeah, that we're going to be optimistic. And I am excited that GAE, we're continuing to move forward for our members and to speak up for our members and speak out on the things that our members care about. So thank you all for joining us this week. Next week, same time, same place, Wednesday, 6:30, we'll have Dr. Michelle Awe, one of our state senators, talking about the vaccines and COVID, and hope she'll have us all that information that we can't answer about how it works and how we can be sure it's safe. And we will see you then. Everyone have a great evening.